So our guest today is Dr. Heidi Millard.
Yes, from Longevity Santa Barbara.
Right, a practitioner of Medicine 3.0, as we use that phrase frequently, and you'll hear more about it in this episode. And it's particularly interesting because she's my doctor. And
Yes.
So I look at things in a different way. But you'll see how we got through the evaluation, the investigation, and making appropriate life changes along this method of increasing longevity and particularly health span.
Yeah, longevity medicine is definitely happening right now heavily. And I loved having her on. I loved how she spoke about being the teacher to her patients. I just really liked that. I really liked her.
Yeah, she's great. So,
enjoy the show.
But what do I know? I'm just a vagina doctor. Dr. Heidi Millard, welcome to the Vagina Doctor podcast.
Thank you. I'm
great
so excited to be here.
It's great to have you with us today. Although you expected this, Karen is with us today, Karen Spaulding.
Yes.
She's my right hand, and she keeps us on the straight and narrow, and occasionally interrupts with questions.
Yeah.
And I actually found her on Instagram.
Yeah.
And reached out to you initially.
Yes.
Yeah,
Yes. It was,
that was the beginning.
It was kind of
Yeah.
a beautiful
Yeah.
start to a friendship here.
Yes.
Absolutely. So you're a physician. You went to Loma Linda Med School,
Yeah, Loma
and
Linda.
then you were on staff at UC Riverside
Mhm.
Medical School.
At their medical school. Yep. I was one of assistant clinical professors there.
Great.
Yeah.
And then you came to Santa Barbara.
Yes. Well, I worked in a couple other places. I worked at two biotech startup companies before coming here to Santa Barbara. My husband's a radiologist, so he did training at several different places. So I went with him to certain places like San Diego. And then I worked at a company in the Bay Area. So I worked at a couple of different biotech companies before coming to Santa Barbara.
And then you founded Longevity Santa Barbara.
Yes.
Tell us all about it.
Okay. So Longevity Santa Barbara is my medical practice that I started about 2 years ago. I'm very passionate about it. There's really two versions. There's a short version and the long version of why and what we do. So maybe I'll start with the short version first, if
Okay.
that's okay. So really all of us, when it comes to our health, what we want more than anything is to live a long and healthy life as much as possible, right? It's true for all of your listeners. It's true for both of you. It's true for myself. But the problem really is, where do we spend our energy to focus on our health, right? There's so much information out there. And all of us are different. All of our health risks are different.
Mm-hmm.
What is your risk is different than mine. So what I really wanted to do with Longevity Santa Barbara is I wanted to be someone's guide, to be able to dive deep into their health, understand a person's health risks so that they can make the changes necessary in order to live the longest, healthiest, and hopefully happiest life possible. That's really, in a nutshell, what I want to do with Longevity Santa Barbara, and that is my passion.
And how are you doing that?
So the way we do that is really with innovative testing. So what I do is I sit down with somebody and I learn about their personal health risks, their family health risks, what their lifestyle is like. And then what we do is we make an assessment of what testing is going to be best for that person, right? So is it going to be genetic testing? Is it going to be whole body MRI imaging? Is it going to be DEXA scanning, where we learn about muscle mass and bone density? And then we do those assessments, and then we kind of create a personalized plan for people to say, this is what we need to do to improve your health. This is how we can increase your odds of improving your longevity and your health for as long as possible.
You know, a lot of people are looking at these two entities, the full body MRI and the DEXA scans, and I can say this with authority because I'm a patient of yours and I'm disclosing that. So,
Yes.
But those tests are done, and they're basically described as normal or abnormal by the physician that's ordered it to the patient. But you do way more than that.
Yes.
And that's what makes you one of the exceptional people in this field. And I've always felt like we only had exceptional people on the podcast. Okay, so that's your reason for the reason why we have you.
Thank you.
Because of that exceptional. So tell the listeners more about that conversation and how, when you get the results, when you get back to the patient, et cetera, et cetera.
Yes. So what we do, and let me actually tell you one of my main mantras is actually a quote by Jacques Cousteau, who, of course, the famous French diver. He once said, we protect what we love what we understand, and we understand what we are taught. And of course, he was speaking about the ocean. But I think the same is also true in healthcare and in our bodies, right? So I, as a physician, am very passionate about teaching, guiding people to help them understand their health risks, right? So I think if I can help someone understand, if I can teach them about their health, then they begin to love their bodies and they begin to protect their health in a way that is very different than just telling somebody, oh, you need to do this or that. But then they take ownership and they can go to a whole nother level. And that is really what I'm passionate about. And that's really how I practice medicine. And so by doing this testing, it's not even just to see, oh, your test showed this, or it's normal or what, but it showed this, and this is what you can do about it. This is what it means. And this is how you can take action to either overcome that health risk or to take action to get rid of it. And really, I want people to be functional for as long as possible, right? We talk about, well, let me even back up a little bit. So the name of my company is Longevity Santa Barbara, right? So the word longevity itself means different things to different people, right? The Webster's dictionary version just means a long life. But the way I mean it is kind of combining these words that you might have heard of, right? So lifespan is the number of years somebody is alive, right? We want to expand that, but we also want to expand somebody's health span, right? So the number of years that somebody has good health and they are not limited in what they can do. You can almost go so far as to say happiness span, right? So how many years is somebody happy to be alive, right? So doing whatever they want to do without limitations with the people they love. I want to expand all of those things. So that's what I mean when I say the word longevity. And when we look at someone's health, I'm a very visual person, right? So imagine when we talk about someone's health, we're talking about their home, right? And there's different pillars, there's different building blocks to somebody's health. Let's say one of those pillars is exercise, right? So what should we be doing as far as exercise? Should it be cardiovascular or weight resistance? And it's different for every person, right? Depending on what their health risks are. Another building block is nutrition, getting the nutrients you need and hopefully not too much of the things we don't need, right? And that's also personalized, right? So your nutritional needs are going to be different than somebody who's bodybuilding, and I just had a baby 5 months ago. So my nutritional needs are going to be very different also, right? So that's going to be a personalized pillar. A third one is sleep, getting really good quality of sleep. That's probably more universal, that we should be getting deep, good quality sleep. Yeah. Another one is good mental health. What are we doing to protect our mental health and kind of optimizing that? Another is probably a combination between creating like meaning and purpose in your life, right? So creating connection with people. All of these things really kind of build the health home. And we work really hard at those. We build those as to be as strong as possible. But what sometimes people neglect is what I consider the foundation of your health, which is doing preventative testing that will prevent chronic disease from ending your life sooner, right? So if we can exercise all day, eat really well, but if we're not doing things that could prevent or detect early signs of heart disease or cancer or osteoporosis, right, then you're really doing yourself a disservice, because those are the things that can kind of knock the wind out of your sails, right? That could really end your life before it should. even if you're doing all of the right things. So that's where I believe that I come in, and we're trained healthcare professionals that can look at somebody's risk and determine what are the things that you personally should be doing to identify your health risks and then take action to prevent those things from ever shortening your life.
This is exactly what I mean by the time that you put into talking to me about my DEXA and my MRI. But are you able to continue that care and advice for the patient ongoing? I mean, you're doing more testing than this. If you see any problems there, or you pick up at the family history issues and so on.
Yeah, or if you see, like, remember he was very concerned about the visceral fat, and like if he had any.
I do remember.
Let's just say somebody, yeah,
really,
and he didn't, which was great.
Well, I still had some.
Let's just say, well, no, you did. I don't think you did.
Well, I was very low percentile of it. Put it that way.
But what if someone has a lot? Then what do you say to that person?
Yeah, well, we identify, I talk with them and say, well, why is it that way, right? Genetics plays a role, but lifestyle and what they're eating and how they're exercising usually plays a larger role. So the first thing is identifying what they're doing that got them to that point. And then the second thing is working with them to create, well, what can we do differently, right? Is it the alcohol consumption? Is that the high processed foods or carbohydrates that are contributing to that? What can we do to overcome that and reverse it, right? Because a lot of these things are reversible. So what can we do to prevent those things? I really would love to work with people's physicians and make sure that they are having continued follow-up. I see myself more as a consultant rather than somebody's primary doctor, right? And so my plan is for them to come back in either 6 months, 9 months, 12 months, depending on what our plan is that we create together to overcome that problem, right? So does that answer your question? That's kind of way.
Yeah.
Mm-hmm. So we kind of create a plan for when I'm going to see them again, what our goals are going to be, and set realistic time frame for when I can see those changes happening.
How long typically, though, does it take, like, for visceral fat to go away if it's been there for a long time?
Yeah. So we all have some, right? So it's never going to go away completely. But if we want to reduce it, it really just depends how aggressive someone wants to be for their diet changes and their weight loss, basically. I've seen pretty dramatic changes even in like 6 months. For most people, probably it takes a couple years if they are on the higher side to really reduce it, right? Not only to bring those numbers down, but to change the behaviors that led to that, right? So a lot of people have been eating maybe more processed foods for years. Those kinds of changes aren't just going to happen in 6 months. They probably need to happen over the course of years, and then your body responds, and then those visceral fat numbers come down.
So you're working with people, like, on their lifestyle. Do you have an opinion about Ozempic and other weight loss?
Yeah, I think that they are fantastic weight loss tools. I think that the research has really shown that they are very effective, but that it requires a conversation. I think it's not one size fits all, right? Really to help people understand that it is a medication that you will probably be on long term, right? The studies show that the real benefits are when people are on it for long term. If they stop the medication, some of the results do reverse, right? So making sure people are informed about that. And then also making sure that they know some of the effects that we see from that medication, right? So really the only one that I can think of is when people do lose a dramatic amount of weight with some of those medications, sometimes they lose a higher proportion of muscle mass in combination with body fat than just traditional weight loss, right? So I think it's important to do like a DEXA scan for those individuals, especially because we want to preserve muscle mass while losing body fat. So we want to make sure that those ratios are proportional and you're not just losing muscle mass as a majority of your weight loss.
Right. And we've been talking just recently about making this test that you do part of our weight management program for anyone on.
I welcome everyone who wants to do that, who's starting one of those programs. It's very helpful.
Yeah, because then you can really see what's going on and not be guessing.
Exactly. And then you can really know what you're targeting, right? Because subcutaneous fat, which is the alternative to visceral fat, right? Those are the two main types of body fat that we have. Subcutaneous fat is really not that dangerous to your health, right? It's really the visceral fat, which is metabolically active. It secretes hormones that make our blood sugar higher, that make our cholesterol higher. So that, from my perspective, is what I'm really targeting more than total body fat, right? So it makes it much more trackable. How do we change that number? And makes it feel a little bit more doable, right? Rather than here's all these numbers and we need to change all of them. Let's really just focus on visceral fat and how we can improve that number.
Yeah.
There are lots of other tests as well. I mean, I think you are really delving deeply into this, the way you're doing it. And I think that the usual screening tests that people, that physicians are ordering sort of on an annual basis, perhaps, are really not very deep.
Yeah.
You look at the lipids and you see, okay, the balance looks okay. But if you don't look specifically at some markers there, you can miss the point.
Yeah.
And there's so much more knowledge out there now regarding that. And we look at inflammatory markers and insulin resistance. And I think one of the great advances that we've seen recently is the continuous glucose monitor.
Yeah.
And I bring it up a lot because it's fascinating, and it's really very, very useful. I personally have an issue with not insulin resistance, although I thought I had insulin resistance because my blood sugar was going high. But it was actually, I have very quick absorption. So I get a peak quite quickly, but I've got to monitor my diet or adjust my diet so that it doesn't go sky high. And the continuous glucose monitor has enabled me to control my blood sugar better by paying attention. Yeah. And that's a painless, fascinating way to do it. And you can see, you don't have to do it all the time.
Right.
Because you can learn. If you pay attention, you can learn what it is. But other things, but there are the muscle mass you talk about. What's interesting is that a lot of people overweight have a lot of muscle mass as well because they need something to carry around the fat.
Yes.
And so when they are going on a diet, you want them to be on a protein heavy diet. So they're going and exercise.
Yeah.
And you mentioned earlier talking about mental health. Well, I was in seeing my own primary physician recently, and he just said, it's been established over the years that the only thing that cuts down the incidence or diminishes the severity of neurological disease, Alzheimer's and so on, is exercise. Now, I love competing in sports, or I used to, okay? But I hate exercising. And so I would think, no, I'm going to agree with the guy who said, yeah, you're going to live 10 years longer if you exercise every day. And then they said to me, well, yeah, but remember, you spent all those years exercising. Maybe that wasn't such a good idea anymore. So that was my excuse.
Yes.
But what I've learned from you and what I've learned from other tests and people in the same field, I've learned so much on the podcast. Yeah. It is all about the podcast for me in terms of that's been my revision book of medicine, frankly. And because, I went to medical school a long time ago, and, what I remember, I've forgotten a lot of it for sure. And what I remember has changed. So, I need to stay aware. And the podcast, putting me in touch with a lot of really fascinating people, has seriously changed my life. And so I started doing testing. Karen has been, let's just say, she would, what's the right word? Tolerant?
I've been very supportive of your testing. I want to see all the results.
Yeah. But, and I was, I've been doing this for a few months. Well, we've been doing the podcast for 6 months. So I really started listening to what people are telling me, the people that knew way more than me, and starting giving that or addressing my patients' concerns in that regard as well. So Karen would sort of right now say that, well, Duncan has a pain in his finger. He's going to get an MRI right away. But I do have access to that. That's one of my excuses. The other one is that I'm concerned, and I'm 77, and things aren't what they used to be. But I've got so much out of increasing or really starting an exercise program, even at my age.
Yeah.
And he looks miserable when he's doing it. It is so funny. That's the picture I need for social media. The look on your face.
Please
Well,
provide
I'm doing
that picture.
my high intensity intermittent exercise.
Yeah.
Yes, I come off the exercise bike or the rowing machine, and I'm like a noodle. Okay?
Yeah, I think we need a defibrillator.
Yeah, you're right. And the other day, I actually did through a friend, Jeremy Battle, who's.
Do you know Jeremy?
Yeah.
Yeah.
I just actually met him just 2 weeks ago.
He's coming on next month.
Oh, great.
To the podcast.
Yeah.
So, yeah.
So he got a new VO2 Max machine, and I'd been talking to a colleague of his saying, where can I get a VO2 Max? Because Peter Attia was saying you really need to do a VO2 Max, and so I did it last week, and Karen and some associates around the office wanted to come and watch, and I said, no, you're not going to do this. So I went and did it, and I was thrilled because I was on the 95th percentile for my age,
Yeah.
which is, and let's brag a little more, it's the 50th percentile for somebody who's 20 years younger than me.
Wow.
Okay.
That's
So
fantastic.
I was thinking, well, really, this did help.
Yeah.
And I honestly, I feel better. I really feel better. But I'm seeing some of these things get better. But the glucose metabolism was an issue for me. That's dietary, really. I have to be consistent with it. But I also did, again, meeting somebody through the podcast, Tiffany Thompson, who's a neurotherapist, and I had a quantitative EEG. And that was, again, fascinating. Cognitive skills were good, but, there were things that need to be investigated. And so this has all been such a learning experience, and from the enthusiasm of people like yourself, and it was Joe Rothman, university professor, UCSB. I mean, just mind-blowing information from him. And if you listen to our podcast that he did, I mean,
I've listened to all of them, I think.
Yeah. And Buck Joffrey, Alan Viglione, Tiffany. I mean, it's been really, really good. So I've made some changes, and I'm embarrassed to say it took me so long. I should have known better.
Well, I think a lot of us are learning not only through you interviewing people, because you've had wonderful experts that have brought a lot of knowledge to your podcast, but also just kind of seeing your experience has been very educational, because I think a lot of people maybe are a little bit timid to do some of these things because they really are not traditional medicine, right? Traditional medicine is very reactive to symptoms, right? It's not very proactive. There are certain things, like colonoscopies, mammograms, pap smears, thankfully, that insurance does cover, but there's so much of innovative technology now that's out there that's able to help people. And I really encourage people, why wait for insurance to catch up with medical advancement, right? If you're able and you're wanting to take your health to the next level, I encourage you to do it now and put that investment in your health, whether it's time, resources, all of those things. And I think by you doing this podcast and doing some of these things, it almost makes it more approachable for the people who maybe have never done any of these things before, So I think it's actually kind of a beautiful thing for us all to learn from the experts, but then also learn from your experience, making yourself a guinea pig. So I think it's a great thing you're doing. Helping people learn what they can do for themselves and also empowering them to do it.
And I think that one caveat there is, and you alluded to this by talking about lifespan and health span, that I think those of us that are paying more attention to this field of prolonging life, we're not trying to prolong the curve that goes down, just stretch that out so it goes on for years. We want it to be a nice, healthy level, and then maybe we fall off the cliff at the end. But it makes much more sense. And I mean, the last thing I think humans want is to be a burden to other people.
Right.
And so that, and age is a huge issue for this, and getting old, and the disease of aging, which is now recognized as a disease. And going back to Joel Rothman again, the lab work that they're doing with fruit flies and worms. I mean, it's funny, but it's real.
Yeah.
And it's and being able to slow it down, or in some circumstances, reversing the aging process. We're not far away from that technology being able to work for people. So when, my thought is then okay, how do we recommend patients to start looking? And I'd like your opinion on that.
Well, yeah, wait. And two, it's like we love the idea of longevity medicine and what you're doing.
Yeah.
How does that become where it is now to something very mainstream, that everyone does?
Yeah.
Like get their annual exam.
Right.
Do you know what I mean?
Exactly. And I think that it's going to take some time for it to get to the mainstream, because not all doctors are even at that point yet where they recognize the value of it. Right.
So true.
Until there's more, I'd say, experience, because that's really what it is. I think that the physicians who don't support some of these things are probably the ones who just haven't had the exposure to it, haven't seen it firsthand. I was able to work in 2 biotech companies where they were doing these really deep workups on people. So I've firsthand seen so many lives changed because of these preventative tests, that I'm a firm believer for life, right? That this can really impact somebody's life and prolong both their health span and their lifespan, right? So to get it to mainstream, I think we need to have more doctors who are advocating their patients and encouraging them to get it. And then to answer your question of what your question was, how do we get more patients to do this?
Yeah. When to start?
When to start? I think now. Now, really, because the earlier we can detect somebody's health risks, the sooner we can do something about it. And we talked before about medicine being so reactive. If we wait for somebody to show symptoms of heart disease or cancer, it's way too late, right? Which is where medicine is right now, right? But if we're able to look at someone's genetics and say like, there's a strong family history of cancer here, we should look at your genetics. And if your genetics is positive, we should be doing colonoscopies for you every 3 years instead of every 10 years. Then that should be done as soon as possible, rather than waiting till you have symptoms of weight loss or other symptoms, right? Same with heart disease. Coronary calcium scores can detect early signs of atherosclerosis even for people as young as 40 and 45. So I think that conversation has to start even when somebody is between the ages of 40 and 50.
What is that?
Atherosclerosis. Thank you. It's basically hardening of the arteries, right?
Okay.
So plaque formation within the arteries of the heart. Tests like coronary calcium scores.
The calcium score.
Calcium score, yeah. It's a very low radiation dosing to determine if someone has calcium in the arteries of their heart, which we can extrapolate to saying they have early signs of that pathway that leads to heart disease and heart attacks.
How sensitive is that test?
That's a great question. It is very sensitive if somebody has it. If someone has a score of 0, it's more helpful if someone has a non-zero score, especially at an early age. We need to be very proactive with those individuals, right? Mm-hmm. So it helps us almost determine what we call in medicine risk stratifying someone, right? So if you have high cholesterol, a calcium test helps us determine, are you somebody at high risk for forming heart disease or at low risk for forming heart disease? And if your score is 0, that doesn't necessarily say you don't have any signs, you don't have any detectable signs, right? So if somebody has high cholesterol and a score of 0, then I say, well, let's talk about maybe repeating it in somewhere between 5 and 10 years. But just recently I saw a rather young individual who had a high score, which would put him in the 99th percentile for his age group. And his cholesterol was only kind of borderline high. He had been pushing to be on medications, and his doctor kind of said, well, your labs are okay. But we did this test for him, identified that he was actually at very high risk for developing heart disease, even though he was in, he younger than 50. And so we were able to put him on medication now and probably change the rest of his life. You know, if we can keep his scores where they are at now for the next 10, 20, 30 years, he's very, very low risk for developing heart disease and heart attacks when he's older.
I think one of the crucial facts that is surprising perhaps to some people is that heart disease or cardiovascular disease is completely avoidable.
Yeah.
Unless the genetics are really bad. But even then,
Mm-hmm.
I mean, if you pay enough attention to it and do the right things with it.
Yeah.
And I know you can see why the cardiologists are so in favor of statins, because it's miracle drugs. I don't know quite why our population has, our society has really very cautious or anti-statins. Statins are super drugs.
Yeah.
It's really incredible. And another super drug, hormones.
Yeah. Well, that's a whole nother controversial cup of tea.
Well, I bring it up for that reason,
Yeah.
because these are things that are life-changing for people. When they're fully active, that's when people are at their strongest and their best.
Yeah.
And all we're trying to do as age goes on and those levels diminish, sometimes more rapidly than others, and certainly in women more rapidly than in men. We need to help those patients and get them on. This is not something they should take because they're waking up at night with a hot sweat, a night sweat. It's something that they need to. It will continue them in good health most of the time. And I know this is in some circles a moderately radical statement, but it is, in my opinion, it's safer to be on hormone replacement therapy than not.
Yeah.
For most postmenopausal women.
I think that is a perfect example of personalized medicine. This isn't a one size fits all. I think that there's a lot of stigma around, especially hormone replacement therapy, that, the research studies that kind of frightened almost all of us, right?
Mm-hmm.
We were taught in medical school that, under only the most terrible situations should someone be on hormone replacement therapy, but otherwise nobody should be on it. And then kind of going back to that research and thinking, well, maybe that's not exactly what that study said.
Right.
And maybe it was taken a little bit too far. And so even now it requires a physician to be open and a patient to be open and understand, well, here are the pros, here are the cons. Here are the things it can help you with. And then kind of making a joint decision on, is that something that is going to benefit you long-term, And yeah, that's a perfect example of something that could dramatically change a person's life.
Yeah.
But yeah, traditional medicine just isn't there yet. And it's going to take some time to get to that point, because we've gone so far to this extreme now to come back to the middle and say, like, well, hey, wait, maybe we should individualize the treatment and see who would benefit, who maybe doesn't need it. And then have it be patient-centered care, right? That's essentially what it is.
That's really what it is.
Mm-hmm.
Yeah.
Yeah.
Wait, I have a question. Lab work.
Mm-hmm.
Is all lab work equal, like depending on the lab? And we don't have to talk about one lab or another lab.
Yeah.
But I'd like your opinion on that, because we go through this at the office when we're ordering tests that we want to be good result, like we're getting all the results.
Yeah.
So do you have an opinion about that?
Yeah, that's a good question. I don't think I have a strong opinion about that. Or maybe I just don't have enough experience with a wide variety of labs to be able to speak on that. You might have more experience on this. I think the bigger issue is what labs are being ordered, right? For most people, it's that, like you said before, is that people are really getting a limited picture, especially when we say what's covered by insurance. Insurance covers a very small subset of what I think is really helpful to people to identify what their health risks are. So I think that is probably one of the bigger limitations than the quality of the lab results that I'm seeing from different laboratories. Does that make sense? But I don't know. What is your experience? Do you feel like there's...
I feel like one of the labs we use has a great cash pay program, which is sometimes less than if you were to use your insurance.
Yeah.
And they have really great labs, that we order. Right, Duncan?
Yes. I think that's the case, and talking to the representatives of the labs is very helpful as well, because that's all changing all the time. They're at the front end, at the sharp end of coming up with the tests that are the most helpful. And I've
especially
really
looking for inflammation. You know, that's the one I'm
right.
Got it.
Yeah. So,
but a lot of I think primary care doctors aren't even checking it. You know what I mean? So
I'll share with you the panels that we're ordering if you'd like.
That would be fantastic. Yeah.
Okay.
Because I think that inflammation does so much for many different fields, right? So I think in traditional training, we were taught it's really only in the setting of like if we're suspecting autoimmune disease or something, you know, but really it's quite an expansive area that if your markers are elevated, we really should be looking at so many things in your life, your sleep, your physical activity level, your cardiovascular risk. Inflammatory markers are so important and they're often underutilized, I think.
What you're talking about now is being coined by Dr. Peter Attia as Medicine 3.0.
Oh, yes.
And I like bringing that up again because it is, those are words that we hear a lot. But what you're describing is exactly that. And it's, you know, Medicine 2.0, which we look at as being reactionary or evidence-based medicine, which there's nothing wrong with that at all, because we're actually very good at that. But it's, as again, I think it's his wording of this, that's playing defense, as opposed to offense, and there's a better way to do it. So
and that's really, so I see myself as a doctor. I am a patient's teacher, right? And so when you learn more about your health and what you could be doing for your health, then you start to advocate for yourself and you start expecting more from medicine, right? And I think that that's a healthy place to be, which leads to the Medicine 3.0. Right?
And to be fair to the doctors that aren't doing that, they generally don't have time.
They don't have time. And it's not reimbursed, and their patients may not always be interested. And it can be costly if you don't have the relationships with like cash pay labs, and you just go to your traditional lab and some of these labs get rejected, you get a really pretty big invoice from that lab department, you know?
Absolutely.
So I'm a huge advocate for helping people understand and asking for what they need from medicine.
I like that you say you're your patient's teacher. I like that a lot. It's a great way to put it, phrase it.
And I think that, thank you. I think that part of that comes from working at the medical school, right? So my first job out of training was working with first and second year medical students. And it's very fun to teach people about medicine and explain to them why we do tests and what we're looking for. And so I kind of just took that same model and applied it to my patients. And I felt that people really responded well to that, you know, as treating them as, I'm your teacher. I am your guide. I have different experience, but you tell me what symptoms you're experiencing and what you want to get out of this. And let's make an educated decision together.
We didn't cover this when we talked before. I'm preparing you for this, but so I'll throw another question and you can choose not to answer it and we can cut it out if you want. Have some thoughts on intermittent fasting.
Oh, I love intermittent fasting. I think it helps people so much. And there's different types of doing it, right? There's intermittent fasting for like fasting for 16 hours or 8 hours. And, you know, there's different types of windows. There's intermittent fasting for several days. Some people do longer things, like even like a week. I've never done anything like that,
right.
But I think it's really helpful. And I think, it helps with insulin sensitivity. It also helps with the psychology of almost empowering yourself that food is a fuel. I'm not a slave to food. So kind of almost resetting yourself, having a boundary between taking yourself away from eating at regular intervals. I think you come to see that relationship a little bit differently as well, you know? So I've seen it help a lot of people with weight loss, a lot of people with insulin resistance. I think intermittent fasting is a very useful tool.
Any thoughts about supplements? I know you're not the primary care physician, so forgive me for the question.
Yeah, no.
But just one of the thoughts.
Yes. You'll hear this repeated. It's such a personalized thing,
Okay.
right? I personally take supplements because I had a baby 5 months ago. You know what I
Right.
mean? So my nutritional needs are very different than somebody else's. I do think that almost everybody is deficient in vitamin D. We're just never outside as much as we need to be.
Yeah.
But other than that, I really do think looking at someone's nutrition and what their goals are for their health, that really kind of has to play in. And I will say that almost most of us, and this isn't a supplement, but most of us aren't getting enough protein.
Yeah, absolutely.
So those kinds of things are more universal, but almost everything else, it's a little bit more.
I'm not guilty of that.
Yes, you're getting plenty of protein in, right?
Absolutely.
It's really hard to get enough
It
protein
is
in.
very hard. Yeah, and it takes a lot of planning and intentionality of, where
It'd
you're
be
going to get it from.
expensive too.
It can be expensive. And not all protein is the same, right? So
Right. Yeah.
if all your protein is from bacon, it's different than, somebody who's eating plant-based proteins and things like that,
Yeah.
So it's very different.
That part's very confusing to me, the protein.
Say more about that.
Just how you get enough protein without eating animal protein.
Yeah.
And what protein is the best to digest and stays in you and what,
Yeah. And I think it takes some trial and error. So I mostly am plant-based. I don't eat a lot of meat. I do eat some lean meats. I do eat some fish. So I exactly understand what you're talking about. It's hard to get protein. You have to eat a lot of legumes, and sometimes I do supplements and things like that. And not all protein supplements are created equal either. Some of them are loaded with sugar. And so you kind of have to be wary of that. And you're talking about digestion. Some of that has to try different types like whey protein or pea protein, and even that's kind of expensive, right? To try which one sits well with you.
Yeah.
But that really can help a lot of people when dietary restrictions, it's harder for them to get that protein in. But I think you're not alone in saying that it's hard to find sources and consistency with getting enough protein.
it really is. Yeah. I'd like to eat more protein, but it's very hard on my system
Yeah.
for digesting and stuff. It throws everything off.
And I think part of it is kind of like fiber, right? So I encourage people to increase their fiber intake, but it has to be kind of a gradual thing, because if all of a sudden you start eating a lot of fiber, your body is not going to tolerate that well. So I kind of think it's similar to protein.
And there's different kinds of fiber. And there you go. The two, they're like hand in hand.
Yes.
It's so confusing.
Your body doesn't like sudden changes.
Yeah.
So it has to be kind of gradual, slow, and almost listening to your body, what your body's tolerating well, and maybe what doesn't sit with you well.
Yeah.
Yeah.
There's this Instagram out right now, and it's so funny. It's this guy, and it says eating in 2024, and he starts to make oatmeal, and then there's a picture of someone on Instagram going, "Don't eat oatmeal. Whatever you do, don't eat oatmeal." And then so he gets some bread out to make toast, and then there's Dr. Gundry, "Don't eat bread." And then he gets an egg, and there's a girl, "Stop eating eggs,"
Yes.
and it's hilarious. And then so he gets an apple, and then there's someone going, "Don't eat fruit." And so he takes the apple and throws it into the...
There is truth to that, right?
Yeah.
And so that's why I think working with somebody who you trust, who's going to navigate through all of this stuff, is really helpful, because there's going to be extremes on every level. So someone who's going to walk with you through this stuff and give you clear guidance, I think is going to be really important, because it can be very confusing to differentiate what's noise and what's actually helpful.
Yeah, I'm going to be your next patient.
Oh, good. Can I ask you, Karen, how has your life changed or practices changed from doing this podcast?
Well, I think the podcast for me is I love collaborating with people. I mean, it's why I reached out to you. It was, I think, before we were even doing the podcast.
Yeah,
I saw that you were new here, and I reached out, and I love collaboration. I love people, connecting. And so for me, the podcast has been that, because I get to reach out to people and say, hey, we have this podcast. Do you want to come on?
Yeah.
Also, it's about feeling really a sense of community in Santa Barbara with all the great people here
Yeah.
and educating everyone on who's here doing these things, because people don't know.
It's true.
Even though there's Google, they still don't know
Yeah.
that. And that's the response we're getting from people that call the office, or I found you on the I found you on the podcast.
Yeah.
And I've learned so much. So I love that. And just, meeting people, talking, being able to enhance our patients' lives with referring and so it's been great.
Well, I've really enjoyed it, listening to it, because I think you're really helping a lot of people, and I think you make a good duo, finding people and bringing their insights to your podcast. I think it's been great.
Thank you. It's been really fun.
One of the things that you wrote in response to the questions we asked you before this was people will describe you as the funniest person they know. Okay.
Yes.
Expand, please.
Do you stand up?
No, nothing like that. I could never stand. It takes a lot for me to sit here in this microphone with you two in this room. I love humor. It's one of my probably favorite things about myself, is that I just love to laugh. I love being around people who are enjoying themselves. And one of my best friends has often told me that she thinks I'm the funniest person she knows, which is a great compliment to me.
Yeah. Compliment.
I'll let you know when I do the stand up.
and one other comment from what you revealed before, which is we'd have to add brave to the description of you, and that is bungee jumping.
That's terrifying.
Probably just once.
Yes,
right?
just once. And even then, I almost didn't do it. But we were in New Zealand, which, if you know, Queenstown is kind of where commercial bungee jumping started. So we were down there. We were like, oh, let's go watch people do it. And it really is like every 10, 15 minutes, somebody's bungee jumping off of this bridge. You have to wait in line and wait for hours to do it. And my husband and I, this was before we had kids, and my husband and I were just saying, going to watch it. And then we said, let's do it. When are we going to be here again? Let's try this out. But I actually am very afraid of heights, and I really didn't want to do it. And I went into kind of almost a catatonic state for like the 2 hours we had to wait for our appointment. And when we finally got up there, I didn't look down at all. And with a very serious face, I asked the gentleman, I was like, can you push me? He said legally he can't. Due to their insurance policies, they can't push anybody. So I understand that. But I was fully willing to just stand there and let someone just give me a gentle nudge. But I did jump, and I felt very accomplished that I could do it. I never want to do it again. But it was a good experience.
Dr. Heidi Millard, it's been great having you here today.
Thank you so much.
Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.